more doctors than ever.
More privatized health care is coming to Alberta. That's according to a leaked draft of new legislation obtained and reported on by the Globe and Mail.
I'll be excited to share this legislation when it's put forward.
The minister wouldn't say when that will happen, but according to the Globe, the bill would allow physicians to work in the public system and the private market at the same time, a first in Canada.
I don't see how this could be consistent with the Canada Health Act at all.
Dr. Braden Manns, a former Associate Chief Medical Officer with Alberta Health Services, reviewed draft documents for the Globe.
There will be winners from this. The winners will be physicians who can get paid a lot more for doing the same thing they're currently doing. And patients who are able to pay will get faster access. The losers will be people who are left in the public system.
The Canadian Medical Association also expressing concerns. Its president writing, "The evidence from around the world is clear. Where a parallel private health system operates, both health outcomes and access to care are worse." In September, the NDP went public with a leaked memo on changes to drug coverage for seniors. At the time, the government said the opposition was fear-mongering over recommendations they'd already rejected, but the minister didn't say that Tuesday.
You know, I can't speak to specifics of legislation before it gets into the House, but I am always looking for opportunities to make sure that Albertans have increased access to the supports and the resources that they need.
Adriana LaGrange went on to promise that no Albertan will be forced to pay out of pocket for essential health care. But the NDP alleges this will create an express lane for the rich and slower lines for everyone else. Leader Naheed Nenshi added it's not a plan the UCP campaigned on.
If they want to start a consultation process, if they want to take it to a referendum, if they want to call an election, I'm in for all of that. But this government's doing none of those things. They're gambling based on dangerous American-style rhetoric, just like they always do.
When pressed about the document in the legislature, the Premier said her government is very pleased by an increase of surgeries now being performed in private centres. From Edmonton, Sean Amato, City News.